Have you ever seen a loved one go through small changes? You dismissed minor issues as a result of growing older? A more subdued appetite? Confusion for a moment? An unexpected fatigue? What if these were something more than the normal aging process? The body gradually ages, but as it approaches its latter stage, it begins to issue subliminal signals. These aren't overt or dramatic. They stealthily enter. All too frequently, families fail to recognize the warning signals until it is too late to make preparations or give their final months a meaningful purpose. Today, we're revealing 5 subtle indicators that frequently show up in the last year of life. Understanding them now could help you give better care, savor every moment, and make sure a loved one's last moments are comfortable and dignified if you've seen any of these in them. Have you ever observed a loved one undergoing mysterious changes? Together, let's investigate their possible meaning. The first indication is sudden weight loss. Beyond aging alone, a vibrant 78-year-old, James had always been known for his passion for eating. His favorite meals were on Sundays. He never refused dessert, and his plate was never empty. But after several months, a change occurred. His sweater, which had suited him beautifully, began to sag over his shoulders. He required a new notch for his belt. And his plate, which had once been full of energy, was now only partially completed. His relatives thought it was a natural aspect of growing older. They reasoned that perhaps his metabolism was slowing down. Here's the reality, though. Significant, inadvertent weight loss is not merely a typical aspect of growing older. It's frequently a serious indicator that the body is having difficulties in ways that aren't always obvious. What is actually taking place? Digestion naturally slows down with aging. Significant weight loss, however, points to a much more serious issue. Atrophy of muscles. Weakness and frailty result from the body starting to break down muscular tissue to make up for missed nutrients. Metabolism. Change. The body can be having trouble processing food completely or using energy more efficiently. Sicknesses that are hidden. Unexpected weight loss is frequently brought on by illnesses such as advanced dementia, cancer, heart failure, and chronic kidney disease. Appetite loss. The body prioritizes vital processes in the last stages of life, which might occasionally result in complete suppression of hunger. Why this is important? Unintentional weight loss has more implications than appearance. Strength, immunity, and even cognitive function are all impacted. Fall risk is increased by frailty. After performing easy tasks, someone who used to walk with ease may suddenly have balance issues or fatigue. Frequent infections are caused by a compromised immune system. Colds and UTIs, which are minor ailments, grow more serious. Isolation can result from low energy. Simply because they feel too weak, someone who used to enjoy talks or outings may begin to retreat. What you are capable of. Early detection of the shift and adaptation are crucial. Pay attention to the signs. Make an appointment with a doctor if a loved one loses more than 5% of their body weight in a few months. Put an emphasis on foods high in nutrients. Reduced. Because muscles and organs don't get enough oxygen due to decreased circulation, movement, and even thought become more taxing. There is a weakened immune system. The body no longer has the energy necessary to fight off minor diseases or even to digest food. There is a sharp slowdown in metabolism. Even when food is consumed, energy levels are reduced because calories are not absorbed as effectively. The lack of muscles makes the fatigue worse. Even sitting or standing up straight can feel daunting when muscular mass declines. The toll on emotions. The body isn't the only thing affected by this tremendous weariness. It affects independence and identity. Imagine a person who used to be active and enjoyed cooking, gardening, and interacting with others, but is now too weak to accomplish the activities that gave them a sense of identity. Their lack of energy may cause them to feel angry, embarrassed, or even melancholy. They may avoid social situations because even chatting is exhausting, not because they don't care. When loved ones are tired, they may mistakenly think they are lazy or unmotivated, but in fact, their body is just running low on resources. How can we help them? The best course of action is to respect their fluctuating energy levels rather than pressuring them to continue being active or to persevere through it. 1. Let them dictate the speed. Suggest sitting by a window or in a garden if they're too exhausted for a stroll. 2. Simplify everyday chores. To lessen physical strain, think about using supportive chairs, slip-on shoes, or lightweight cutlery. 3. Promote frequent hydration and small meals. High-protein, high-calorie diets can assist them maintain their energy levels, and dehydration exacerbates weariness. Chapter 4. Establish a calm atmosphere. Excessive stimulation, loud noises, and bright lights can be too much to handle. A peaceful, quiet environment helps reduce discomfort. 5. Give yourself permission to relax guilt-free. Allow them to sleep more during the day if necessary. Their bodies are aware of their demands. One last thing. Forcing someone to continue when their energy wanes is not the solution. It's providing them comfort and tranquility. Make the time they have left as comfortable and meaningful as you can, rather than dwelling on what they are no longer able to do. Sign number 3. Bewilderment and retreat. Then everything seems different. Maria had always been perceptive, the type of person who could vividly recollect things from decades past and who never forgot a birthday. However, she paused one evening while setting the table for supper, a bewildered expression on her face as she held a spoon in her fingers. What had I done? To herself, she whispered. Her relatives initially laughed it off. Everybody occasionally forgets things. Then she began to forget even more. She went for her daily afternoon stroll a week later, but she stopped in the middle since she didn't know how to go home. She started to retreat the following month, opting to sit quietly rather than participate in conversations and simply nodding in response to inquiries. She used to adore knitting, but her daughter noted that she hardly touched her projects. It was more than just forgetting. There was more to it. Why is this taking place? In the last years of life, confusion and retreat are frequently confused with typical aging. In actuality, however, they indicate more profound alterations in the body and brain. 1. Less oxygen reaches the brain when circulation slows, which makes it harder to remember things, make decisions, and even have basic conversations. 2. The brain is putting vital survival processes first, leaving little energy for social interaction or mental work. The body is conserving energy. 3. A normal emotional retreat. People who are nearing the end of their lives often withdraw because it is difficult to interact with their family, not because they don't love them. A once enthusiastic loved one may be sitting quietly, gazing off into space, or appearing to be deep in contemplation. They may stop returning calls or turn down invites they used to like. When it's more than just aging, these moments can be devastating, but they are unintentional. Everyone experiences memory lapses, but some changes point to a more severe decline. A person may become easily overwhelmed in social circumstances, lose interest in once-loved activities, wake up unsure of where they are or what time it is, struggle to understand conversations, or forget the names of close family members. This disorientation can occasionally occur abruptly. Overnight confusion in a loved one may indicate an infection, such as pneumonia or a urinary tract infection. Infections in older people don't usually manifest with overt symptoms like fever. Present, but doing so frequently just makes them frustrated. Instead, prioritize comfort over accuracy. 1. Instead of asking, "Do you remember when we went to the beach in 1998? Simplify your conversation. Try this. Isn't the ocean incredibly serene? Talk in a straightforward and comforting manner. 2. Establish routines with them. When words are too hard for them, reading to them, playing soothing music, or just combing their hair can help. 3. Establish a serene atmosphere for them because bustling spaces and loud noises can overwhelm them. 4. Be patient and be silent. Even if they don't answer, your presence is reassuring and serves as a different form of farewell. It can seem as though someone is vanishing before they're really gone when they begin to withdraw, and in many respects they are. They still feel love, nevertheless, even if they don't react as they once did. Play their favorite music, hold their hand, and sit next to them in peaceful company. These little moments are more significant than you may think because their hearts continue to sense the love around them even when their words stop. Sign number 4. John always recovered fast from colds despite having sluggish healing and frequent infections. He would recover in a few days with a little rest and some hot tea. However, things were different last winter. Weeks passed while a slight cough persisted. He was less energetic than normal and stayed in bed longer. Before he was admitted to the hospital with pneumonia, his family thought it was just another seasonal illness. What causes this to occur? The immune system deteriorates with age, making it more difficult to fend off infections and heal minor wounds. Seriousness can swiftly develop from what appears to be a simple sickness. Myth: there's no need to panic. It's only a cold. The truth: a simple cold can turn into a serious illness when the body is unable to fight it off. Chapter 1. Reduced production of white blood cells, the body's first line of defense against germs and viruses, results in a weakened immune system. Second tip: slower recovery. Even minor injuries may take weeks or never heal completely due to poor circulation, which reduces the amount of oxygen and nutrients that reach the wound. Chapter 3. Hidden illnesses. Seniors don't often exhibit obvious symptoms of infection, in contrast to younger persons. Urinary tract infections, or UTIs, can induce abrupt disorientation instead of discomfort. Unusual weakness or exhaustion, which are classic indicators of infections in the elderly, may be the only symptoms of pneumonia rather than a high fever. A common symptom of sepsis or UTIs is sudden confusion or disorientation, severe exhaustion that does not go away with rest, skin that bruises easily or wounds or sores that don't heal, sweats, chills, or a low-grade fever that doesn't go away. What are you able to do? Treatment is never as good as prevention. Even while you can't prevent every infection, you can lower the chances by making simple yet efficient changes. 1. Keep an eye out for subtle signs of infection, such as sudden weakness, loss of appetite, or confusion. Don't disregard these modifications. 2. Maintain the health of your skin. Dry, thin skin is more likely to break and become infected. Every day, moisturize and look for wounds or redness, especially in people who are bedridden. 3. Assist them in staying warm. Seniors who have poor circulation are more susceptible to disease. Make sure they utilize blankets when necessary and dress warmly, even indoors. 4. Promote hydration since dehydration impairs immunity. Throughout the day, provide tiny sips of electrolyte liquids, herbal tea, or water. 5. Reduce the amount of germs you come into contact with by promoting frequent hand washing and disinfecting high-touch items like phones and doorknobs. Priorities typically change from vigorous treatments to comfort and prevention when an aging loved one begins to have sluggish healing and repeated infections. The objective is to safeguard their health before issues develop, rather than merely responding to sickness. When a loved one becomes unwell more frequently, families may feel powerless, but even modest actions like keeping them warm, making sure they drink enough water, and recognizing symptoms early can have a big impact. Because maintaining dignity, comfort, and quality of life in the last stages of life is more important than simply curing illness. 5. Adaptations. What's going on within the body? The heart and lungs lose their effectiveness when the body slows down. Only the most vital systems are given priority by the body, which limits blood flow to the extremities and routes oxygen and circulation to the heart and brain. 1. Weaker heart function. The heart finds it difficult to pump oxygen to the body since it can no longer pump as forcefully. This results in pale or bluish skin, cold hands and feet, and low energy. 2. Breathing irregularities. Breathing becomes increasingly irregular and shallow as the respiratory system slows down. Your loved one may appear to hold their breath for extended periods of time before taking another faint breath. 3. Skin tone changes. Cyanosis, a bluish or purplish tint, particularly in the hands, feet, and lips, indicates decreased oxygen circulation. Patchy patches of discoloration may also give the skin a mottled appearance. Identifying various breathing patterns. Shallow, laborious breathing. The lungs have trouble taking in deep breaths, which results in weak, rapid inhalations. Breathing that alternates between deep, fast breaths and periods of silence is referred to as Cheney-Stokes breathing. It is typical in the last few hours or days of life. When mucus accumulates in the throat due to a weakening of the swallowing reflex, a death rattle sound is produced. Family members may find it upsetting, but it usually doesn't make them uncomfortable. How to offer solace throughout this period. There's no reason to freak out when you observe these changes. These symptoms are the body's normal method of slowing down, not an indication of pain. It is now your responsibility to provide your loved one with dignity, comfort, and peace. 1. Maintain a tranquil atmosphere for them by turning down the lights and making less noise. A calm atmosphere can be created using soft, low lighting. Since hearing is frequently the last sense to deteriorate, play soothing background music or natural noises. Don't talk too much. The most consoling gift is sometimes a silent presence. 2. Facilitate breathing. Positioning is important. The sensation of suffocation can be avoided by supporting them with pillows. Breathlessness may worsen if you lie flat. Make use of a humidifier or fan. This can lessen any sense of dyspnea and preserve airflow. Provide gentle comfort if they appear agitated. A gentle touch or calming voice might assist ease the difficulty of breathing caused by anxiety. 3. Keep them cozy and warm. In the latter days, circulation slows down, which causes cold hands and feet. As temperature control deteriorates, cover them with a soft, lightweight blanket rather than an electric blanket. To promote circulation and foster a feeling of intimacy, give moderate hand massages. 4. Hold their hand and concentrate on their sensory well-being. The tactile sense is still very strong, and it can be very reassuring to feel your presence. If their lips appear dry, moisten them with ice chips or a moist cloth. Steer clear of pushing beverages since this can make swallowing challenging. Diffuse lavender or other soothing essential oils if they have a preference for certain fragrances. Your presence is the most potent gift. Words might not be needed at this point. Even if they don't react, your loved one can sense your presence. More comforting than any drug can be provided by just sitting with them, holding their hand, or petting their forehead. Peace is in order now. The emphasis is now on maintaining dignity, peace, and love rather than medical procedures. The last breath can be drawn slowly and softly, like the flickering of a light before it goes out. It is a precious moment, a passage from one stage of life to another, even though it is terrible. The best present you can give is your presence, when the words fade and the breath slows. Decline is not the only aspect of aging. It has to do with change. It's about changing our mindset from battling against time to appreciating the important times. Fear is not the reason to recognize these indicators. It's about planning, about understanding when to concentrate on comfort, dignity, and tranquility rather than prolonging life at any costs. It's not only a medical procedure as a loved one approaches the end of their life. For all those concerned, it's an emotional journey. By being aware of these indicators, you may provide them with what they most need, not just attention, but also your presence and affection. Which of these symptoms have you observed in a loved one, I ask you now? And after watching this, what is one thing you will do differently? Leave a comment with your ideas. I read each one.